Day. My name is Peter Wayne, and I'll be talking today about Tai Chi for fall prevention in older adults. But before beginning, I wanted to take a moment to thank Dr. Li Shudong, Secretary General for the World Tai Chi Federation, for the invitation to this event, and also to Dr. Li Shulin and others from Inner Mongolia Normal University for organizing this very important event and for inviting me to participate. I'm honored to be able to contribute. I'll begin my talk today by talking about the prevalence and burden of falls in the elderly, not just in the United States, but worldwide. We know this is a very important public health issue in our aging societies. I'll next talk about the risk factors for falls, and in particular, how Tai Chi can help prevent falls, being a multimodal or multi-component intervention, lots of different therapeutic components that may impact all the different risk factors for falls. I'll then focus on two mind-body particular mechanisms related to prevention of falls in Tai Chi. So in addition to the physical components of Tai Chi, the strength, the flexibility, there are mental aspects, and the two I'll focus on today are affective motor, or the anxiety that we know is related to fear of falling, and cognitive motor interactions, where we believe that executive function plays an important part of balance, control, and fall prevention. Then I'll say a little bit about some other ongoing and future studies in this area. I believe everybody in this room appreciates that falls in the elderly are a very significant public health issue. About 1 out of 3 adults over the age of 65 fall each year, and this results in significant injuries to individuals, some of which can be quite severe. Fractures, for example, in the spine. 1/5 of adults with a fracture will die within the 1 year due to the side effects of the falls, the sequelae. Okay. There's also very significant costs associated with falls to society. In the United States alone, it's estimated to be about $55 billion in the year 2020 for fall-related medical costs. And because our society and many others are growing in terms of age, these numbers are expected to go up. In addition to fractures and falls, having a concern about falling can deeply impact people's behavior, and they're less likely to meet with friends and socialize, which can then have further negative effects on health. There's a lot of risk factors that we know about associated with falls. They've been divided into what's called internal or intrinsic, and things that are external or extrinsic. The ones I'll focus on today are the intrinsic ones, and having a prior history of falls, taking multiple medications, having multiple comorbidities like pain and cognitive decline. These are all factors that I believe that Tai Chi can make a difference in. And there's some strong evidence to support that. We have a working definition. I'm sure everybody in this audience knows what Tai Chi is, but our working definition when we share this with our Western audiences is that it's a mind-body exercise that's rooted in multiple Asian traditions, including Chinese medicine, philosophy, and the martial arts. And it integrates slow movements, intentional movements with breathing, and a number of cognitive skills, including mental focus, heightened body awareness, and imagery. And the aims, of course, are to strengthen, relax, and integrate the mind and body, improve health, personal awareness and development, and for some people who practice it as a martial art, for self-defense. This is a cartoon we developed to help explain to the Western population what Tai Chi is, and that it's very different than a drug, which has a very specific single active ingredient. Tai Chi is a very complex therapeutic ingredient with multiple therapeutic components. So on one level, Tai Chi is like a physical exercise. It's moderately aerobic, as we know. It works the musculoskeletal system, but it's not just working individual pieces. It works how all the pieces connect in a more dynamic structural way, how they integrate, the very specific biomechanics associated with the training in Tai Chi. In addition to the physical body, there's relaxation of the mind, Sung principles, and a lot of cognitive things. We're paying attention to the body, we're being mindful, interoception is trained, proprioception is trained. There's also imagery and visualization, what we Chinese would say yi, or intention. And we know that what we believe, our focus, has deep physiological effects. There's good research from placebo, imagery research, visualization to support this. There's focus on breathing. There's focus on most Tai Chi happens in social groups, and we know that being part of a group can have a therapeutic value. And there's even philosophy in most of the way Tai Chi is taught. Don't use 100% effort, maybe 70% effort. Don't try too hard. Go with the flow. Many of these philosophies will change people's behavior and lifestyle, which we also think is therapeutic. So lots of different things happening in a Tai Chi intervention, regardless of whether it's a Yang style, Wu style, Sun style, any other. And this can also be applied to yoga and many other interventions. And this diagram is an important one. It pretty much summarizes one of the key points of my talks, which is that all of these different components together can affect many different risk factors for falls. So these are all risk factors for falls. Each one of these has been studied in some randomized controlled trial of Tai Chi. But we know that people who fall, older adults, have weak muscles, especially lower extremity. Tai Chi has been shown to change the strength of knees and legs and hips and other body parts. Lack of flexibility increases risk of falls. Being stiff, Tai Chi improves that. Lack of sensation in the soles of the feet, or proprioception, is associated with higher risk of falls. Tai Chi has been shown to change that. And I'll be showing some examples of this. How we react to stepping on a curb or a carpet and slipping, how quickly we react, and how efficiently we react is also affected by Tai Chi in a positive way. I'll be saying some things about anxiety and executive functions go along. I won't be saying much about pain, but we know that pain is an independent predictor of falls. People who are in pain move differently, but they also are distracted by their pain. And we think that this can increase the risk of falls. And we know that Tai Chi is quite helpful for a number of types of musculoskeletal pain, including osteoarthritis of the knee, neck pain, and back pain, for example. Okay? So you get the idea. This is very different than studying a Western drug where one specific ingredient targets one receptor in the body and affects health changes biochemically from there. Here we have many active ingredients affecting many different parts of the system and working in a more ecological or complex systems kind of. So what is the evidence for Tai Chi and falls? There are a number of rigorous meta-analyses and systematic reviews out there. These are just a few of them. There's some new ones that have come out as well. The Cochrane Review, which is focused mainly on older community-dwelling adults, relatively healthy, suggests about a 20% reduction in falls. Some of the other reviews, which include higher risk fallers like people with Parkinsons or stroke, suggest a 30 or even 40% reduction in falls. A very nice paper on this topic is by Sam Nyers from England. It's published in 2022, and he did a review of all the systematic reviews, and the conclusion is that there's high quality evidence that Tai Chi prevents falls in community settings, but the evidence for preventing falls in assisted living facilities or hospitals is less robust. There's been some important big trials that have come out lately. I'm going to share one by Fuzhang Li, who's here in the United States in Oregon. This is a study published in JAMA Internal Medicine. It was a 3-arm trial with a good sample size of 220 people. He was evaluating a program called Tai Chi for Better Balance, which is based on a Yang style that he developed. 1/3 of the people received Tai Chi, so 224 people in the Tai Chi group. Another third of the people received multimodal exercise that included resistance training and stretching and those sorts of things, but not the mind-body practice of Tai Chi. And a third group did exercise seated. And it's a robust study. This training went on for 6 months of training, and this is what they found. They found that after 6 months, there was almost a 60% reduction in falls when you compared the Tai Chi group to the seated control stretching group. Even when you compared Tai Chi to the multimodal exercises, there was about a 31% reduction in falls. This is very significant. What was also interesting is they followed people up for 6 months, and serious injuries are the ones that are most impactful for individual lives, but also for costs to society. And Tai Chi, compared to the stretching group, had a 75% reduction in injurious falls at 12 months. So this is really significant. One of the most promising interventions we have for fall prevention. There's also some evidence, this is also from Fuzhong Li's group, but other people have recently published some examples, that not only is it clinically beneficial, but that it's cost effective. That the amount of dollars that you spend versus the benefits in terms of reducing health costs, that ratio is very favorable. And it improves quality of life years and what's called incremental cost-effective ratio. What's important is that these clinical trials done under very controlled conditions also seem to work when you extend them out into the community in what's called implementation research or very pragmatic studies. This is also from Fuzhong Li's group. It's the same intervention. He took this intervention out of the laboratory and went to 35 adult senior centers in the state of Oregon. There's a total of 511 people in this study. The programs were offered for 48 weeks, and what they found was that 89% of the centers that started these programs completed them for the 48-week program, so there was good adoption by these centers. It was very practical to do in the community. 77% of the individuals who registered for the program completed the program, and what they found was a 49% fall reduction, very similar to what they saw under controlled conditions in the laboratory. So this translates out into community-based programs in the United States. So what is the evidence of Tai Chi for preventing fall-related fractures? One of the reasons we care so much about falls is because when people fall, there's a high risk of fractures. And fractures, as I mentioned before, can have really serious consequences on health, with maybe 1 out of 5 adults who have a fracture dying within a year due to the sequelae or the side effects of not being able to socialize, to care for themselves, to exercise, etc. The evidence for Tai Chi preventing fractures is much more limited than the evidence of Tai Chi for preventing falls. There's a couple systematic reviews. This is one of the more recent comprehensive ones. And what we see here is a couple things. One, there's a lot of heterogeneity in the studies, a lot more heterogeneity than in the Tai Chi for fall studies. And the effect sizes here for the femur, the upper leg, is moderate. It's about 0.58, which is considered to be a moderate effect size. The effect size for the lumbar spine is much smaller. It's about 0.26, a very small effect size, but statistically significant. An important thing to point out here is that the majority of these studies are done in Asia. And while they're relevant for predicting fractures in Asian populations, because the bone metabolism of white people or African American people or Hispanic people outside of Asia is quite different, maybe these results are not as applicable. So we don't know enough about the impact of Tai Chi outside of Asian populations. So this is an area that we were pursuing in our own research. This is a small study that my colleagues and I did a few years ago, about 10 or 12 years back, looking at osteopenic women and asking whether Tai Chi can slow down the rate of decline in bone density in this population of women. And we studied out osteopenia for a few reasons. There's about 40% in the women in the United States alone who are above 50 years of age have osteopenia or early stages of osteoporosis. This is 5 times more women than those that have formal diagnoses of osteoporosis. And while osteopenia has a lower fracture risk compared to people with full-blown osteoporosis, the total number of fractures per year is much greater because of the higher prevalence in osteopenia. Guidelines for treating osteopenia in the United States are not very well developed, and medications are typically not prescribed. People are told to do some exercise and to monitor things, but typically they're not very compliant to their exercises, and many of them transition into having osteoporosis. And as I said before, there are many studies in China that suggested that Tai Chi might improve bone mineral density, but we didn't know whether this would translate into women in the United States. So we did a small study. This was 86 people that were randomized to receive standard of care in our hospitals at Harvard versus Tai Chi plus standard of care. They received a bone density scan using DEXA or dual X-ray absorptiometry. We also measured markers of bone turnover. I'll say some things about that in a bit. We looked at exercise behavior and balance, because we also wanted to know whether Tai Chi was improving their balance and decreasing their risk of fractures that way. We followed them for 9 months, and the unique aspect of this study was that it was delivered in the community. So we let people pick Tai Chi schools that we had screened and approved of all throughout the Boston area. And I'll show you a picture of that in a minute. The intervention was 9 months long. For the first month, they were asked to go to 2 classes a week with some home practice, often given materials to either read or video recordings. For the remaining 8 months, they went to 1 class a week, and they were asked to practice at least 3 times at home. Many of them did more. They could also go to more classes in the community if they wanted to, and we assessed attendance and home practice logs. The standard of care, they just followed the recommendations of their physicians, including recommendation for exercise, and taking calcium supplementation was also monitored. This shows you a picture of the Tai Chi schools in the Boston area that were included, and so we wanted to make this as convenient as possible. For many people, going to Tai Chi classes for 9 months, even though it's supported by the study, still requires a lot of time and travel and expenses. So we wanted to make it as easy as possible, and we let them register not just at places in the hospital, but places throughout their communities where they might work or live. So there are 8 schools or 8 locations that they can pick from. And again, these schools included Yang style, Chen style, Wu style, and Sun style. And they could pick whichever was most convenient for them. And we did not tell the teachers what to do. They were teaching as if these students were just their regular students and not part of a medical study. So the inclusion criteria were these women were 45 to 7 years old, and they had to have osteopenia, meaning a T-score between -1 and -2.5. They couldn't have had fractures, they couldn't be on medications, they couldn't have any other complicated medical situations. And they could not have been practicing Tai Chi for some years. We measured bone density using DEXA, and we measured this in the laboratories at Harvard Medical School hospitals. We measured DEXA, or bone density, at the hip and at the spine, looking at L1 through 4. And I'll be showing some results for the femoral neck, the total hip, and the total spine. And this is the basic finding that we had from our study. In this standard of care group, so these women are osteopenic, are postmenopausal, and their estrogen levels are dropping quite quickly. You can see here that in the control group, the standard care group, the density at the femoral neck, the top of the femur bone, went down 1% in 9 months. This is very typical for postmenopausal women, right? In the Tai Chi group, in terms of the intent to treat, meaning anyone who was randomized to Tai Chi, there was almost no loss, essentially zero loss. And for those women who actually went to classes on a regular basis, did at least 75% of the classes and 75% of the home practice, there was almost a 0.5% increase in the bone density in the hip. And this difference for the per protocol between the standard of care and the Tai Chi was significant. We saw similar positive trends for the total hip and the spine, but this is a small study and the observation period was for a short period of time. So these changes were just trends and were not statistically significant and have to be cautiously interpreted because of that. We also brought people into the motion laboratory at one of our hospitals where we can study their balance very carefully. This is an example of some of the instrumentation we have. We can have people do various balance exercises or different Tai Chi exercises. Each one of these dots is an infrared sensor. There are cameras all around the room. And from this, we can calculate a lot of very detailed, specific measures. Here, this vertical line is the movement of the center of gravity relative to the center of pressure. And it gives you a measure of sway, which is a predictor of falls. This diagram here shows what's called a stabilogram. This is the movement of the center of pressure over time, right? And this is in the medial lateral direction and the anterior posterior. And basically, the greater the sway range and the faster the sway, the greater the risk of falls, according to some studies. This gives you an example of one of the women's changes in balance over the 9 months using this technique, these force plates, and the Vicon system. Here, this is looking at medial lateral sway left to right. You can see at the beginning there's a lot of sway, but over time, especially in this medial lateral plane, there was less sway. So there was improvements in postural control in this population. This looks at the average statistics of those parameters of sway. We have 3 groups here. This is the control group. You can see their sway is increasing over 9 months, whereas those in the Tai Chi group, especially the red ones, which did more practice, had improvements in both anterior postural sway as well as sway velocity, the speed of that sway. This is based on 10 trials and sample from all the groups. We also looked at bone remodeling, and we can look at this using 2 different assays. Resorption talks about how much bone is being resorbed into the bloodstream or dissolving, so it's breaking down of bones. And one of the more sensitive tools for that is called C-terminal cross-linking teleopeptide of collagen, or CTX. It's serum-based, so we get this from the blood. And osteocalcin can also be assayed from the blood. And that is a measure of how much bone is being formed or reformed. And we hypothesized that Tai Chi would have anti-resorptive effects and be expected to see decrease in biomarkers of both resorption and formation because they're typically coupled. And what we saw was just that. There were modest effects of Tai Chi in the per protocol group. There were significant decreases for both CTX and osteocalcin. These are, again, small samples, but they suggest that what we're seeing from DEXA is supported by bone markers of turnover. So I want to say a little bit about the mechanisms associated with Tai Chi's impact on falls, and again, just focusing a little bit on the affective and cognitive pieces of the Tai Chi component. So one of the biggest predictors of falls in older adults is fear of falling. And as you can see in this woman coming down the stairs, she's holding her breath, she's got some chi stuck in the chest, her center of gravity is high, and people who've had falls get very anxious about falling again. And that fear of falling leads to them not exercising as much, not going out to visit friends, not doing shopping, and moving around less. And that limited mobility and limited socialization makes their physical fitness go down. As their physical fitness goes down, their balance goes down, and their confidence goes down. They get even more fearful of falling and increased risk of falling. And it's a vicious cycle. It's very hard to break. Okay. And what we've learned from a lot of studies, and there are nice meta-analyses on this, is that one of the ways that Tai Chi may be impacting people is not just by strengthening the legs and improving biomechanics and posture, but by changing this fear of falling. Okay, so fear, and there's some really good studies that have shown that reductions of falls in clinical trials are mediated by changes in fear of falling. More generally, we found that Tai Chi improves overall self-efficacy. It gives people more confidence to exercise. So it's a nice introduction for people who've been very ill or deconditioned by hospitalization to return to exercise in a safe way and to reduce their risk of falls. So I also want to say something about the links between cognition and Tai Chi. Okay, so the short answer, or the key point I want to make here is, as we all know, is that the way you think affects how you move, and the way you move affects how you think. And Tai Chi as a mind-body exercise treats both the body and the mind together. Okay, in terms of falls, independent of how strong your legs are and whether you smoke or not or any other factors, how your cognition works is very related to your risk of falls. So executive function is an important part of cognitive health. Executive function is what helps you shift attention from one task to another, to multitask, to plan, to organize your thinking. And for people, even with very intact cognition, no signs of dementia or mild cognitive impairment, but have just a modest deficit in executive function, there's a 44% increase in risk of falls. And so what's going on in the mind, your ability to pay attention, your distraction, has a huge impact on falls. And we believe that Tai Chi is training the mind and the body, and this is one mechanism through which Tai Chi may be imparting its benefits. We've done some systematic reviews. There's some new ones out there. The results are not tremendously different, but based on some good trials and a growing number of neuroimaging work, much of it being done in China, it looks like Tai Chi is very good for cognitive health and in particular executive function. And as I said, this is supported by some nice neural network analysis showing that changes in the brain are correlated with changes in clinical measures of executive and global cognitive function. So one way to evaluate the impact of executive function on gait and vice versa is to use what's called a dual task paradigm. And basically, it's asking, is there a cost to thinking or talking while you're walking? And what we want to know ultimately is, can Tai Chi minimize this cost? This is some data from Jeff Hausdorff in Israel, and the main focus of this data here, this is not based on Tai Chi, is that when people are asked to do complicated thinking tasks, it changes how quickly they walk, their speed, but also the rhythmicity of their steps, how variable their steps are in time. Both of these are predictors of falls. So no dual task, no distraction, people walk faster. If you ask them to count backwards by threes, they get slower. By sevens backwards, they get even slower. And similarly with these challenging tasks, no dual tasks, they walk very regularly. And when they count backwards by sevens, there's a lot of variability. Both of these, again, are predictors of falls. So we want to know, if you're learning Tai Chi, can it reduce the cost of thinking while you're doing something in the real world, moving around? This is a woman in our laboratory walking on the top panel without counting backwards. This is her counting backwards by threes. This is an older woman, and you can see, especially when she turns the corner here and starts to walk back the other way, two things. One, this is in real time, so she's walking much faster when she's not being asked to count backwards. But also look at the spacing between the steps. They're much more regular in this top panel than they are in the lower panel. And our question was, if this woman learns Tai Chi, when she's walking like in the bottom panel and counting backwards, will it look more like the upper panel? Can we reduce the cost of this mental distraction? In other words, do mind and body work better together after Tai Chi? And the short answer is yes. This is a study led by one of our postdocs, who's now an associate professor at Harvard, Brad Manner. And this is in a group of older adults, some of which were close to 100 years old. Some were in, average age was about 84 years old. This is 12 weeks of Tai Chi training. This is dual task walking speed. Those in the control group who received health education for 12 weeks showed no improvement. Those in the active Tai Chi group showed significant improvements in walking speed. We've also been able to look at this in Tai Chi experts in the Boston area. Tai Chi is a very rich, there's a rich Tai Chi community in Boston. These are Tai Chi experts that have an average of at least 25 years of training experience in Tai Chi from many different systems, and we compared them to age-matched older adults who were 50 to 80 years old. These are very healthy adults who are not taking many medications. So, and when we compared the experts to the naives, in this case we're looking at variation in rhythm, so not speed. So the more high this number, the more variable you are, and the higher your risk of falling. The lower the number, the more regular your steps are, and the lower risk of falling. And you can see that the experts were significantly lower than their age-matched controls. So this means long-term Tai Chi is good. But we wanted to also know whether short-term training can help adults. So we took all of the Tai Chi naive people, 60 people, and randomized them to receive Tai Chi for 6 months versus be in a waitlist control group. And what we saw were similar trends. Short-term Tai Chi training starts to make these adults look closer to the Tai Chi experts. Not the same magnitude, but they start to move in that direction. We've also done this in Parkinson's disease. This is looking at the stride time variability, again, the variability in the timing of the steps when people walk. In Parkinson's adults who've done Tai Chi, we've reduced their variability compared to those who were in the usual care. We've also looked at some of the physiology of lower extremity muscles. This is looking at what's called co-contraction. And we're looking at two complementary muscles in the lower leg, the gastrocnemius and the tibialis anterior. And typically in healthy walking, while one is firing, the other one should relax, and vice versa. So they have this interweaving sine wave. But for people who have poor gait or at higher risk of falls, these muscles co-contract. They work less efficiently. And so we were looking at whether Tai Chi can change the levels of co-contraction. And overall, Tai Chi reduced the level of co-contraction in these muscles, so they were walking more efficiently. And you can also see that co-contraction is affected by this this mental task of counting backwards. So just to bring this all together in this short talk, I think it's fair to say that Tai Chi is a promising intervention for enhancing balance and preventing falls in older adults. That the multi-component mind-body training of Tai Chi, as opposed to just weight training or taking a pill, may afford unique advantages over unimodal therapies. Balance, cognition, and affect are all affected, and they all are interdependent. How you think and your emotions and anxiety affect your balance and vice versa. This supports a more ecological or systems-based framework for studying aging and the potential benefits of mind-body therapies that target multiple processes. This work is based on some collaborations with many people. I don't have time to mention them all, but I'm just a small member of these teams, and I want to acknowledge the support and collaboration of many, many colleagues from different institutions. And finally, I want to let you know about a very exciting conference we're holding at the Harvard Medical School in September of 2023. It's called The Science of Tai Chi and Qigong as Whole Person Health. It's being hosted by our Osher Center. It's going to be a 2-day international event, and we really hope that you'll consider coming to present some of your research, to meet some colleagues and form collaborations, to make new friends, and to see our beautiful city of Boston. So please consider coming. You can go to this website and you can find new information about the dates for abstract submission and how to register. So thank you again for inviting me to participate, and thank you for listening to my presentation.